She had been invisible for 3 years. Quiet, careful, keeping her sleeves down, her head low, her past buried under 12-hour shifts and the kind of silence that looks like weakness if you don't know what it's hiding. Lauren Hayes was just a floor nurse at Iron Harbor Medical Center. That's what they all believed. That's what she let them believe. Then 2 Black Hawk helicopters fell out of the sky, and the woman nobody respected became the only person standing between 6 Special Forces operators and death. Because the team didn't come for the doctors. They came for her. They came for Echo. If this story has you hooked already, hit that subscribe button, give this video a like, and drop a comment telling me what city or country you're watching from. I want to see how far this story travels. Now let's go back to the beginning. The storm had been building since morning. By the time Lauren Hayes clocked in for the evening shift, the weather advisory on the break room television had been upgraded twice, and the sky outside Iron Harbor Medical Center's east-facing windows had turned the color of a bruise. She poured herself half a cup of coffee she didn't want, checked the ward roster, and pulled on her compression gloves, the thin ones, the ones that covered the ink on her left forearm without looking obvious about it. 3 years. She'd gotten good at it. Hayes, the charge nurse, a broad woman named Deb Torrance, was already pointing at her from across the station. "We're short on 3. Dr. Hale wants you in the supply corridor doing inventory before the storm lockdown." Lauren didn't argue. She just nodded and picked up the tablet. That was the thing about being invisible. Nobody thought to wonder why you never pushed back. The supply corridor was on the hospital's west wing, a long fluorescent-lit hallway that smelled like disinfectant and old cardboard. Lauren worked through the count steadily, her penlight tracking boxes of saline, suture kits, intubation trays. Around her, the building groaned as the wind picked up outside. The storm, what the local news was now calling Hurricane Marta, had made an unexpected inland track, and Iron Harbor, 20 miles from the coast, was going to take a hit. She was midway through the 3rd shelf when she heard the argument starting from down the hall. Dr. Preston Hale's voice carried. It always did. He had the kind of vocal projection that came from years of believing every room belonged to him, and tonight he was using it to dress down one of the second-year residents, a young man named Kenji Ota, who'd made a dosing error on a pre-op patient. Lauren kept her eyes on the shelves. "Told you twice already. If you cannot follow a simple protocol, I don't know what you're doing in my ER. This isn't community college, Dr. Ota. We have actual patients." A pause, and then footsteps approaching. Lauren moved slightly to create the appearance of deep focus. She wasn't fast enough. "Hayes." Hale had turned the corner, Ota a half step behind him, looking like someone had just emptied him of everything. "What are you doing down here?" "Inventory. Deb sent me." Hale looked at the tablet in her hands, then at the shelves, with the particular expression he reserved for things he considered beneath his attention. He was a tall man, lean in the way people get from not eating enough and caring too much about how they look in a white coat. The coat was pristine. It was always pristine. "We're heading into a category response," he said. "I need experienced staff on the floor, not—" He gestured at her, at the shelves, at the entirety of the supply corridor. "This. I'm following the charge nurse's directive. Deb answers to me." He said it like a correction. "Finish up and get back to 3. And Hayes—" He paused, and she could feel him deciding whether to say the next thing. He said it. "Try not to get in the way when things start moving. You're a floor nurse. Act like one." She watched him go. Kenji Ota lingered for half a second, met her eyes with a look that was somewhere between apology and relief that the target had shifted. And then he followed. Lauren put her penlight back in her pocket, finished the count, filed the report. Act like one. Outside, the first band of the hurricane arrived. Rain hit the building's north face like gravel thrown from a truck, and the lights in the corridor flickered once, held, then dropped to backup amber. The ER was controlled chaos by 9 o'clock. Storm-related injuries had started trickling in before the rain even reached full intensity. A contractor with a rebar puncture from a job site collapse, 2 elderly patients whose caregiver had panicked and driven them in through worsening roads, a teenager with a head laceration from a falling tree branch. Lauren worked steadily through all of it, triaging, positioning, running vitals to the residents who barely looked up when she handed them the numbers. Hale was in his element. Whatever else he was, the man was a competent emergency physician, and in high-volume situations, he moved with a precision that Lauren had to respect even when she despised the person it lived inside. He barked orders, redirected traffic, made calls fast. Ota shadowed him and found his footing again. The floor hummed. Lauren was at the nurse's station entering documentation when the radio scanner on the desk crackled. Hospital security kept one tune to emergency dispatch, and a burst of garbled voice traffic broke through the static. She almost missed it. Most of the words were swallowed by the storm interference, but 2 syllables came through clean, and her hand stopped moving on the keyboard. Blackhawks. She looked at the scanner. Then she looked at the windows, at the dark and rain-hammered glass. Then she picked up her radio badge and walked to the charge station, where Deb was trying to sort out a bed management issue by phone. "Deb, can you pull the emergency dispatch channel on the main board?" Deb covered her phone. "Why?" "I heard something on the scanner." Something in Lauren's voice. Not urgency exactly, more like a very controlled kind of stillness, made Deb put the hold on her call and reach for the board. The main dispatch feed came through the ceiling speakers, patchy with interference but audible. Confirmed crash landing, 2 aircraft, exterior helipad, and secondary field approximately 600 meters north of Iron Harbor Medical. Multiple casualties, nature and number unknown, requesting trauma activation. Repeat trauma activation. The ER charge desk lit up with the incoming trauma line. Deb's face went from routine to something else entirely. She reached for the overhead paging system. Lauren was already moving. "What?" "They came in through the ambulance bay because the helipad was unusable in the wind. The first vehicle was a civilian emergency truck that had been out on a grid response. The second was an Iron Harbor Municipal Fire Rescue Unit. Between them, they were carrying 6 men, and Lauren knew the moment she saw them through the bay doors that these were not people who had been in a traffic accident or a building collapse. They were all male, all young, all built in the way that didn't come from gym memberships. 2 were ambulatory, holding each other up, one with a head wound wrapped in field dressing that was already soaked through. 3 were on backboards, unresponsive or semi-conscious. The 6th man was the one the paramedics were working hardest on. They had him on a stretcher with manual chest compressions ongoing, shouting handoff information as the bay doors opened. Pneumothorax suspected, tension, right side, declining sats, BP was 70 palp in the field. Lauren pulled on her trauma gloves and moved to the stretcher. The man on it was early 30s, dark-haired, the left side of his face a mask of blood from a scalp lac. His lips had gone gray. His chest barely moved. "What's his name?" she asked the paramedic. "No ID, no credentials. None of them have any identification on them. The 2 walkers said not to ask." Lauren glanced up at the 2 ambulatory men. They were watching the stretcher with the particular flat intensity of people trained to function through things that would stop everyone else. One of them, taller, close-cropped beard, a field dressing wrapped around his right forearm, met her eyes. "Where is Echo?" he said. His voice was quiet, not a shout, quieter than the room deserved, and somehow that made it land harder. Lauren held his gaze for exactly 1 second, then she looked back at the patient. "Get him into trauma 2. I need a chest tray, a 14 gauge, and someone call respiratory now." "Hayes," Deb was at her shoulder. "Dr. Hale takes the trauma calls. He's in 3 with the contractor. This can't wait for a room transfer." She was already moving with the stretcher. "Page him. Tell him we have a tension pneumo incoming." The team moved into trauma 2. Lauren snapped her gloves tighter, positioned at the patient's right side. The monitor leads went on. The numbers confirmed what the field report had said. Oxygen saturation at 71 and dropping, heart rate irregular, pressure non-existent. She looked at the chest wall. Right side, reduced expansion. Tracheal shift, subtle but visible to someone who knew to look. She reached for the needle decompression kit. Whoa! One of the nurses, a younger woman named Priya, put a hand on Lauren's arm. "We wait for the attending." "We have about 90 seconds before this becomes a code," Lauren said. "Get your hand off me." Priya stepped back. The door opened. Dr. Hale came in, coat still perfect, reading the room fast. His eyes went from the monitors to Lauren to the kit in her hands. What is happening? Tension pneumo, right side. I'm going to decompress. You're going to step back and let me assess. If you want to assess, assess. I'll walk you through what I'm seeing, but we're not waiting. Hale looked at her, the look he'd developed over 3 years of small dominations, and opened his mouth. Let her work. The man with the beard was in the doorway. He hadn't raised his voice, he hadn't needed to. The room went slightly strange around the words, the way rooms do when someone who knows how to make a statement enters them. Hale turned. This is a medical facility. I don't know who you are. No, you don't. The man didn't move from the doorway. Let her work. Something in the delivery broke Hale's momentum. He looked at Lauren. He looked at the patient, whose saturation had just dropped to 68. Fine. He said it like a concession that cost him nothing. But I'm watching every step. Lauren had already found the second intercostal space, mid-clavicular line. She prepped the site in 4 seconds. The needle went in. The rush of air was audible. The monitor's alarm lowered its pitch. The patient's chest wall began to move symmetrically. The saturation crawled. 69, 72, 78. Nobody in the room said anything. Lauren kept her focus on the monitor, on the rise and fall of the patient's chest, on the placement. Her hands were steady. They didn't shake. This was the thing she had never been able to explain, even to herself. Away from this, in ordinary life, her hands trembled sometimes. Not from weakness. From containment. The body straining to hold something back. But when the moment arrived where there was nothing to do but work, the containment released, and what was underneath was something else entirely. Chest tube next, she said. He needs a tube. I'll place the tube, Hale said, moving in. She stepped aside and handed him what he needed, and she noticed, though she said nothing, that his hands weren't entirely steady either. What? By the time they had the first patient stabilized and tubed, the ambulance bay had received 2 more transfers from the crash site. The information was fragmentary, assembled from what the fire crew said on their way out and what the 2 mobile operators, because that's what they were, Lauren was certain of it now, chose to reveal, which was almost nothing. 2 Black Hawk helicopters, a training flight or something that had been framed as one. The storm had come in faster than the forecast suggested, and the second aircraft had gone down hard, the first attempting an emergency landing that had resulted in a rollover. Survivors had been extracted by a ground team that had arrived within minutes, which meant there had been a ground team positioned nearby, which meant this was not a standard training accident. Lauren processed all of this the way she processed everything, quietly, internally, without showing it. She moved between the incoming patients. One had a femur fracture and a compromised airway. One had a head injury significant enough that she flagged him immediately for neurology. The 2 men who had walked in were less critical than they appeared, one with a concussion and a deep lack, one with what turned out to be a dislocated shoulder and 3 cracked ribs. She worked. She triaged. She directed. Around her, the ER staff moved at the altered pace that crisis creates, where normal hierarchies soften and people fall into whatever role the moment needs. Hale ran the trauma bay. Ota managed the secondary cases with surprising competence. Priya, who had grabbed Lauren's arm earlier, caught on fast to what Lauren needed and stopped waiting to be told. The man with the beard stood in the hallway outside Trauma 2 for most of it. Lauren passed him 3 times. He was watching the room, watching her, and the second time she passed him, she said, without stopping, "Your teammate is going to need a second look at that dressing." She saw him look at his own arm. He hadn't been thinking about himself. She was already past him by the time he answered. "He's going to be all right?" She stopped. "Your man in 2. He's stable. We'll get him to imaging in the next 20 minutes. He nodded once. "Thank you." She resumed walking. 20 feet down the hall, she stopped at the medication station, and she stood there for a moment with her back to the ward and her hands on the counter. The supply closet, the census board, the coffee she'd never finished. 3 years of small, ordinary days stacked on each other like sandbags, and one storm had taken 4 hours to undo all of it. Where is Echo? She pressed her left forearm flat against the cool surface of the counter. Through the compression glove, she could feel the edge of it, the ink, the old scar beneath, the mark she'd carried since a forward operating base in a country she wasn't supposed to have been in, placed by a medic who told her she earned it and she should never be ashamed of it. She had been ashamed of it anyway, not of the mark, of everything the mark meant she was, and everything it meant she'd lost. She straightened, pulled the glove tighter, went back to work. Paptad. It was nearly midnight when Karen Whitmore appeared. Iron Harbor's hospital administrator did not typically appear on the ER floor during emergencies. She appeared at board meetings, at ribbon cuttings, at the kind of events where reputation was managed and photographs were taken. Seeing her at the charge desk in a rain-damp blazer, face tight, phone in hand, was the kind of displacement that stopped Lauren mid-stride for just a moment. Whitmore was talking to Hale in a low voice that was trying to sound casual and wasn't. Lauren caught pieces of it as she passed. Military involvement means federal protocols, Preston. If we didn't follow the right admission procedures, we have 6 critically injured men in my emergency room, Karen. The procedures I followed were the ones that kept them alive. That's not what I understand that, but we need to document the intake correctly or the liability. Talk to legal. I'm busy. Lauren kept moving. She was coming back from the supply corridors, genuinely, this time, not as a punishment, retrieving a second chest drainage kit, when she nearly walked into the man with the beard again. He was standing outside the imaging annex, and this time there was a second man with him, older, with close-cut silver hair and the posture of someone who had spent decades making rooms obey without raising his voice. Lauren registered him immediately. The rank was invisible, no uniform, civilian clothing, but the bearing was specific and unmistakable. The older man looked at her arms, at her gloves. "You're Lauren Hayes," he said. It wasn't a question. "I'm the nurse who stabilized your man," she said. "Dr. Hale is the attending of record." "I'm not looking for the attending of record." She looked at him. "We've been looking for you for 14 months, he said. "We didn't expect to find you here." The corridor was empty enough that his voice didn't travel. Somewhere behind them, the ER hummed and beeped and rattled with wind against glass. The storm hadn't peaked yet. The forecast said it wouldn't peak until 3 in the morning, and Iron Harbor was already running on generator backup for 2 of its 4 wings. Lauren said, "I don't know what you think you know about me. I think I know that the woman who just placed a needle decompression in under 4 seconds and talked Preston Hale into submission without raising her voice is not a floor nurse who stumbled into her career." He paused. "Echo." The word landed like something physical. She hadn't heard it spoken aloud in a very long time. Not like that. Not with that weight behind it, the weight of what the word had meant in a different context, a different life, a different version of herself that she had tried very hard to put down. She said nothing. The older man held out his hand. "Colonel Mark Duvall, 3rd Special Operations Group, retired, currently operating as DOD liaison. The man your team just kept breathing is Staff Sergeant Remy Voss, and he is someone we cannot afford to lose." Lauren looked at his hand, didn't take it. "I'm on shift," she said. "I know. There are still patients that need attention. I know that too." She looked at him for a long moment. Then she looked at the man with the beard, the younger one who had been the first to ask the question, who was watching her now with the particular expression of someone who has been searching for something and is still not entirely sure they've found it. "How did you know where to look?" she said. Duvall's expression didn't change. The crash wasn't entirely an accident. Someone positioned this flight specifically tonight, specifically here. "We've been trying to understand that for the last 3 hours. He paused. "But that's a conversation for when you're ready." Lauren processed this. The lights in the corridor flickered as another generator transfer kicked in. From the ER bay, she heard Deb's voice, elevated, tight, calling for support on an incoming case. Lauren looked at the drainage kit in her hands. "I have to get back," she said. "Of course." She started walking. "Miss Hayes." Duvall's voice came from behind her, even, unhurried. "Sergeant Voss has your call sign tattooed on his right shoulder. He's had it since Carivo province. He said if he was ever in trouble and Echo was anywhere in the world. She stopped. She didn't turn around. Duval finished. She'd find a way to the room. She stood there for exactly 3 seconds, the drainage kit in her hands, the hum of the building around her, the storm outside pressing against everything. Then she kept walking. In the ER bay, Deb was managing a new admission. A civilian, a middle-aged man with chest pain and a blood pressure number that made Lauren recalculate everything she'd been thinking about the last 3 minutes. She moved to the station, pulled the chart, began asking the right questions. She was a floor nurse. That's what she was. That was the story. She pressed her left forearm against her side, felt the edge of the glove, the edge of the ink beneath it, the edge of a name she had not answered to in 14 months. The man on the table in front of her winced. She put her hand on his arm, the right one, and said calmly, "You're okay. We've got you. Tell me where the pain started." He started talking. She listened. Outside, the hurricane pressed its full weight against the building's north wall, and the lights held, and Lauren Hayes stood in the center of the storm, in the center of all of it, and did what she had always done when the world came apart around her. She worked. She kept working. She did not look at the door to the corridor, even when she heard footsteps approaching from that direction. Heavy, purposeful footsteps that stopped just outside the bay entrance and did not come in. She did not look. She kept her eyes on the patient, on the monitor, on the numbers that told her what he needed. But her left hand, the one with the glove pulled tight over something she hadn't let anyone see in 3 years, had begun to shake. Not from fear. She recognized the difference. Not from weakness. From something she had no name for yet. From the specific trembling of a thing that has been held down very hard for a very long time and has just felt for the first time the possibility of not having to be. The trembling stopped before she made it to the second monitor check. That was how it always worked. The body threatened, then corrected itself, then moved on without explanation. She had learned a long time ago not to have conversations with her own nervous system in the middle of a shift, because the nervous system would always win and the patients would pay for it. The man with chest pain was named Gerald Fouch, 63. A retired school teacher who had been trying to secure his storm shutters when the first band hit and had driven himself to the ER because his wife was out of town and he didn't want to be a bother to anyone. He had a blood pressure of 168/102, an irregular pulse, and the particular quality of embarrassed stoicism that Lauren had learned to read as a warning sign. Men who minimized their symptoms were often the ones who'd been symptomatic for hours. "You drove yourself?" she asked, not looking up from the chart. "My neighbor offered, but she's got 2 kids to watch." "Mr. Fouch, how long has your chest felt like this?" A pause. "Since around 4. It was 12:18 in the morning. Lauren kept her expression neutral. "I'm going to need a 12 lead, and I want to run some labs. I'm going to ask Dr. Hale to come take a look at you." "Is it serious?" She met his eyes. He had the look of someone asking a question they already knew the shape of the answer to. "Let us get the information first. Then we'll talk about serious." He accepted this with the quiet dignity of a man who'd been managing his own fears for a long time. Lauren moved to the corridor to flag down the cardiology pager, and it was in that moment, standing at the station, waiting for a callback, that she became aware the corridor outside had changed. 2 men she had not seen before were standing near the ER entrance. Not patients, not family, both in civilian clothes, both carrying themselves with the specific deliberateness of people who were there professionally. One was on a phone. The other was watching the charge desk. Lauren turned back to the station as though she hadn't noticed. But she had. Deb found her 20 minutes later near the end of a supply handoff for the 4th military casualty, the one with the head injury, who had been transferred up to neuro but who'd had a vital sign drop that brought him back down to ER holding while they waited for a CT slot to open. "Someone's asking for you," Deb said. Her voice was careful in a way that meant she wasn't sure what she was delivering. "Hale?" "No, not staff, a woman. She's been at the desk for 10 minutes and she won't talk to anyone else." Lauren looked up from the vitals sheet. "What woman?" "She won't give a name. She's—" Deb paused, looked like she was choosing words. "She said to tell you she's from Clearview." Something cold moved through Lauren's chest, fast, like a stone dropped in water. Clearview. The word meant something specific to exactly 3 people in the world, and 2 of them were currently either unconscious in a trauma bay or standing somewhere in this building pretending to be civilian observers. The third was Lauren herself. She set the vitals sheet down. Where is she? The woman was waiting in the family consultation room off the west corridor, a small beige room with chairs that were trying to be comfortable, and a box of tissues on a table that implied things often went badly in this room. She was standing when Lauren came in, which was deliberate, because the woman did nothing unintentionally. She was around 50, compact, with silver-threaded dark hair pulled back, and the particular quality of absolute attention that Lauren associated with people who spent their careers in rooms where every piece of information mattered. Lauren stopped in the doorway. "You want to close that?" the woman said. Lauren closed it. "My name is Adrienne Sorrell," the woman said. "I'm not going to offer you credentials because the kind I carry wouldn't mean anything to the staff here, and the kind that would are not something I'm going to display in a hospital family room. I need you to take a minute and listen to me." Lauren put her back against the door. She was still in her scrubs, still had her gloves on, still had everything about her positioned to go back to the floor the moment this conversation was over. "How do you know that word?" Lauren asked. "I know all the words," Sorrell said. "Clearview, Echo, Carivo, Sector 9. She let those land, then kept going. "I know your full service record up to the official end date, and I know what isn't in your official service record, which is considerably more than what is. I know you didn't leave voluntarily, and I know you've been here for 3 years because someone made sure you didn't have anywhere else to go." The room was small. Lauren felt the closeness of it. "Who sent you?" she asked. "No one sent me. I'm here because Mark Duval called me from the parking lot of this building 40 minutes ago and told me that 2 of his birds went down in a Category 2 storm that had no business making the kind of inland track it made, and that one of the men he brought in was Remy Voss, and that Remy Voss was alive because of a nurse named Lauren Hayes who moves like someone who has spent time somewhere other than a nursing floor." Sorrell paused. "I came because I needed to see it myself." Lauren said, "See what?" "Whether they actually managed to bury you." Sorrell looked at her steadily. "They didn't." Lauren's jaw tightened. "You need to understand what happened tonight," Sorrell said, her voice dropping slightly, not to softness, but to precision. "That flight path was not random. Someone routed those helicopters through a corridor that they knew would intersect with the storm's track. Someone who had access to flight planning and weather analysis, and who had a reason to want those men in trouble. That's not my operation. No, but you're in it now whether you want to be or not. Because the men who came in on those birds, the surviving ones, have been running a counterintelligence inquiry for 8 months, into the same records that were altered to end your career." Lauren stood very still. "That's why they were looking for Echo," Sorrell continued. "Not because they were in trouble and needed a medic. They were looking for you because you're the only person outside their chain of command who has direct knowledge of what happened in Carivo. And your testimony, if anyone could establish you were still credible, still findable, would close a gap in their evidence that nothing else can close." The fluorescent light overhead hummed. Lauren said, "They tried to kill the flight." "We don't know that yet." "You think that's a coincidence? Those specific operators, that specific flight path, on a night when the storm is the justification?" "I think it's exactly what you think it is," Sorrell said quietly. "I also think that whatever is happening, it accelerated tonight, and the people responsible know it, which means the next few hours are going to matter considerably more than the next few months." Lauren looked at her hands, at the gloves, at the left forearm beneath them. "I'm on a shift," she said. "I know. I have patience." "I know that too." Sorrell said it without impatience. "I'm not asking you to leave. I'm asking you to understand the scope of what's already arrived." A knock at the door. Deb's voice muffled. "Hayes, we need you back. Fausch and Bay 4 is asking for you, and Hale wants a consult on the second—" "Be right there," Lauren called. She looked at Sorrell. Sorrell reached into her jacket and put a phone on the table. A simple flip model, old, the kind you couldn't trace with standard tools. "If you need to reach someone tonight, the number's already programmed." Lauren didn't move to take it. Sorrel left it there and stepped back. The men in your care right now, they came here as a team. Whatever you think about the rest of it, they came in together and they're going to want to leave together. That counts for something. She moved toward the door. Lauren stepped aside. One more thing, Sorrel said, hand on the frame. The two men near your ER entrance, the ones you clocked when you came back from Fuchs's Bay. Lauren said nothing. Confirmation. Don't approach them. Don't acknowledge them. They're not a threat tonight. They're watching to make sure the situation stays contained. But they're not ours. A pause. Just know the room. She left. Lauren stood in the family consultation room for 12 seconds. She counted them. Then she picked up the phone from the table, put it in her scrub pocket, and went back to work. Gerald Fuchs was having a NST EMI. The labs confirmed it, the EKG confirmed it, and the cardiology resident who'd responded to the page, a sharp young woman named Dr. Talia Osai, who moved fast and spoke faster, confirmed it within 4 minutes of walking in the bay. They got him on the protocol quickly. Aspirin, heparin, a call to the cath lab, which was running a skeleton crew because of the storm, but had a team that could be reached. Lauren stayed in the bay while Osei explained the situation to Fuchs, who absorbed the information with the same quiet dignity he'd shown earlier, and who asked only one question. Am I going to make it through tonight? Osei looked him in the eye and said, That's what we're going to make sure of. Fuchs nodded. He looked at Lauren. You're the one who caught it. The numbers caught it, Lauren said. I just read them. He looked like he wanted to say something else. Then the transport team arrived to move him to the cath lab prep area, and the moment passed, and Lauren stepped back into the current of the ER. The military men were being managed in a separate cluster of bays, 3 adjacent spaces that the charge desk had informally consolidated into a single zone, which was unusual and a little improvised, and was exactly the kind of practical decision that got made during mass casualty events when the alternatives were worse. Hale had a problem with it. Technically, he'd said something to Deb about protocol and designated trauma spaces. But the patients were stable, the monitoring was adequate, and Hale had 4 other active cases that needed him more. Lauren checked in on Voss first. He was conscious now, which she hadn't expected. The chest tube had done its work, his saturation was holding at 94, and he had been given enough analgesic to take the edge off what she knew had to be significant pain without dropping him back under. He was propped slightly in the bed, an IV in each arm, and his eyes tracked her when she came in. Hi, she said. I'm Lauren. I'm the nurse who... I know who you are. His voice was raw from the tube down his throat, graveled. Mac told me. Mac, the man with the beard. She filed this. How are you feeling? She asked, because it was the right thing to ask, and because she genuinely needed to know. Like I fell out of a helicopter, Voss said. That tracks. She checked his tube position, checked the drain output, looked at the monitor. Does anything feel different from when you came in? Any new pain, any pressure? My head. He squinted slightly. Not the laceration. Behind my eyes. She noted this. The head CT was still pending. That could be from the pressure equalization, said. The pneumo affects things fast and the correction can cause headaches. We're going to image you as soon as a slot opens. She moved around the bed, checking the IV sites. The slot should open in about 20 minutes. He watched her. You didn't know we were coming. No? But you knew what we were the minute we came through the doors. She kept her eyes on the IV. I recognized the field dressings. A small silence. Echo, he said. She straightened. That's not a name I use here. I know, Mac explained. He paused, and she could see him working through something, some calculation of how much to say. I had your call sign put on me because I was 18 and you saved my life, and I didn't have any other way to make it mean something. He said it like a statement of fact, not like an appeal. I'm not asking you to be that person again. I know it's not that simple. She looked at him. I'm just glad you were here, he said. She said, get some sleep if you can. The CT techs will come get you. She went to the door. The storm's getting worse, he said behind her. I know. Are you going to be okay? She stopped. She turned that over and the unexpectedness of it. He was the one in the hospital bed with a chest tube and a laceration and a pending head scan, asking if she was going to be okay. "Yeah," she said. "I know how to manage a storm." She went back to the floor. Maki. It was just past 2 in the morning when Dr. Hale found her at the medication cart. The ER had reached that specific quality of late-night crisis stillness. Not quiet exactly, but compressed, everyone operating in focused silence. The rhythm settled into something sustainable. New admissions had slowed because the storm had made the roads effectively impassable. The patients they had were the patients they had, and the staff had organized itself around that reality. Hale came around the corner of the cart with his hands in his coat pockets, which was unusual. He didn't carry himself that way when he was in command mode. The pocketed hands meant something. "I need to ask you something," he said. Lauren looked at the medication label she was checking. "Okay." "The military unit, the 6 men. What about them?" "I've been reviewing the admission notes." He paused. "The interventions in trauma too, the needle decompression, the decisions in the first 4 minutes." Another pause. "That wasn't nursing care." She kept her eyes on the label. "I've placed maybe 40 needle decompressions in my career," Hale said. "You placed that one in under 5 seconds. Site prep, angle, everything. I've watched surgeons take longer." "I've seen a lot of them in my career," she said. "Where?" She looked up. His expression was, she searched for the right word. Not hostile, not exactly. Something more complicated, which she hadn't expected from him, because complexity wasn't what he usually offered her. "I've read the ICU protocols you wrote for the seasonal overflow," he said. "You wrote them 2 years ago. Deb filed them under a general submission. I found them last month because I was updating the department reference library, and they were better than anything we had on file." He held her gaze. "I didn't say anything about it at the time." She waited. "I should have," he said. "I didn't, and that's—" He stopped, recalibrated. "I'm not good at this." "I can tell." "The 2 men in civilian clothes near the entrance," he said, shifting. "They showed credentials to security about an hour ago, DOD level. Security called Karen, Karen called me, and now I have a hospital administrator telling me we may have a federal situation developing in my emergency room, and she wants to know if we should consider transferring the military patients to Harwick Regional." Harwick Regional was 40 miles north in road conditions that were currently unpassable. "That's not a viable option," Lauren said. "I know it's not. That's what I told her." He looked at the floor briefly, then back up. "She's going to try anyway. She's going to find a reason." Lauren pulled the medication she needed. "Why are you telling me this?" Hale was quiet for a moment. Outside, the storm flexed. A full pressure shift, audible in the building's bones. The kind of sound that reminded you how much structure stood between you and open weather. "Because I don't think she should," he said. "And because whatever is happening with those men, your involvement in it seems to matter. And I've spent 3 years being—" He stopped again. "This one cost him more than the last. Not seeing you correctly. And tonight I'm finding out that's my problem, not yours." It was not an apology. It wasn't quite complete enough to be one. But it was the closest to honest she had ever heard from him, and she gave him credit for that, even as she registered how much of her she'd had to compress for 3 years to survive his version of her. "The patients stay," she said. "Tell Karen the transfer is medically contraindicated. Use those words. She'll back down from specific medical language." He nodded. "And Dr. Hale." She picked up the medication tray. "Sergeant Voss needs his CT. Can you push that priority?" He pulled out his pager. "Already on it." She moved past him. She was halfway to the bay when the lights went out. Not the flicker of a generator transfer. Those she knew had learned the half-second warning dip before the backup kicked in. This was different. This was full dark, everywhere, instantaneous, followed by an abnormal delay before the red emergency lighting pulsed on. 3 seconds. Maybe 4. Long enough for 2 things to happen simultaneously. Somewhere down the corridor, she heard a crash that sounded like equipment, and in the ambient darkness before the emergency lights took over, She heard a voice, one of the two men from the ER entrance, close, very close, say something low and fast into a radio. The emergency lighting came on. Lauren was already moving toward the military bays. She came around the corner at a controlled jog and stopped hard. The bay where Voss had been was empty. Bed stripped back, monitors unhooked, IV lines disconnected at the port. No sign of a struggle, no overturned equipment. The drain unit had been cleanly capped and removed. Someone had moved him, and they had done it fast and clean and in the dark, and they had known exactly where the lines were and exactly how to detach them without triggering a blood back alarm. That was not something an ordinary person did. She checked the adjacent bays. The man with the head wound, still there, vitals intact, monitor running. The man with the shoulder, still there, sitting up, looking confused and alarmed by the power event, but present. She went back to Voss's bay. On the pillow, where his head had been, there was a single piece of torn gauze with 3 letters written in pen. ROOF. She looked at it. She looked at the ceiling. She looked at the empty bed. Then she looked at the door to the stairwell, which had a slow-close hydraulic hinge that was still, just barely, completing its arc back to the frame. Lauren put the gauze in her pocket, turned, and walked with flat, deliberate steps back to the medication station, where she pulled the flip phone from her scrub pocket. She opened it. 1 number. No label. Supo. She pressed call. It rang once. Sorrell's voice. Tell me. Voss is gone. Someone moved him during the blackout. He left a message. 3 letters. Looks voluntary, not a grab. He went somewhere in the building. A pause. The roof, Sorrell said. That's what it says. Don't go up there alone. Someone's meeting him up there, Lauren said. Someone who knows this building's layout well enough to know the roof access on the east stairwell bypasses the security checkpoint. Another pause. Shorter. How do you know about the east stairwell? Because I've worked this building for 3 years, Lauren said, and I've had a lot of time to learn its exits. She ended the call. Pocketed the phone. Looked around the ER floor. At the staff, at the patients, at Hale moving across the far end of the bay cluster with his pager in hand. Then she pulled off her compression gloves, both of them, deliberately, and set them on the medication cart. She rolled up her left sleeve. The tattoo was simple, a circle of line work, technical, like a targeting reticle, with the letters ECHO woven into the design in a font that was barely readable unless you knew to look. The ink was dark and clean and had held well for 7 years. She looked at it for exactly 2 seconds. Then she went to the east stairwell, pushed the door open, and started climbing. The stairwell smelled like concrete and standing water. Someone had propped the east stairwell door on the ground floor with a wedge, a rubber doorstop, the kind that lived in maintenance closets. And the wind pressure from the storm was creating a low, sustained moan through the gap that followed Lauren up the stairs like something alive. The emergency lighting in the stairwell ran on a separate circuit from the main backup system, which meant the red wall-mounted fixtures were on and functional, casting everything in the color of a developing bruise. She climbed fast, not running, conserving breath, keeping her footsteps controlled. 4 floors. Iron Harbor Medical Center had 5 stories and a mechanical penthouse, and the roof access was through a door at the top of the east stair that was supposed to require a facilities key. The door had been broken for 14 months. Lauren knew because she had submitted the maintenance request herself, twice, and both times it had been deprioritized by someone in Karen Whitmore's administrative chain. The irony of that was not lost on her. She reached the 4th floor landing and paused. Below, she heard the stairwell door open. Someone following, more than one set of footsteps. She didn't stop. She went through the final half-flight to the roof access door and pushed. It opened. The storm hit her like a wall. Even at roof level, even with the mechanical penthouse housing partially blocking the direct wind, the air was a physical force. Horizontal rain hard enough to sting, and a wind speed that had to be 60, maybe 65 miles per hour in the gusts. The roof surface was dark and running with water. The standpipe housings and HVAC units were shapes in the darkness. lit only by the distant flicker of the city's remaining functional streetlights and the building's own rooftop nav beacons, which were blinking red on their statutory cycle. Lauren stepped through and let the door close behind her. She found Voss in the lee of the largest HVAC unit, 20 feet from the door. He was on his feet, which was either impressive or alarming. She hadn't decided yet. He'd taken his IV lines with him, capped at the ports the way she'd noted, and he was in a hospital gown and the compression socks they'd put on him in the bay, which meant he was standing on a wet roof in approximately no practical clothing, and his chest tube was, she looked, still in place, the drain bag tucked under his left arm. He was not alone. The man with him was not Mac. Lauren had not seen this man before. He was older than the operators she'd treated, late 40s, with the kind of build that had once been very specific and had broadened with age. He had no visible injuries. He was in civilian clothes, dry ones, which meant he'd been in the building before the storm peaked and had not come through the same entrance as anyone else. She registered this. "You need to be in a bed," she said to Voss. "I know." Voss's voice was strained. The climb had cost him. She could see it in the way he was holding his left side. "I needed 5 minutes. 5 minutes on a roof in a hurricane with a chest tube. It was the only place I was certain wasn't monitored." Looked at the man beside him. The man looked back at her with an expression of specific assessment, not hostile, not neutral either, calibrating. "This is Duval's contact?" the man said to Voss. "This is Echo," Voss said. The man's expression shifted. Something moved behind his eyes that Lauren couldn't fully read. "I didn't think you'd come up," he said. "I wasn't planning to." She took 3 steps toward Voss, put 2 fingers on his wrist, counted pulse. Elevated, but within tolerable range for someone who just climbed 4 flights of stairs post-pneumothorax. His skin was cold from the wind. His lips were not yet blue. She had maybe 8 minutes before the exposure became a clinical problem. "Say what you need to say." The man looked at Voss, then back at Lauren. He reached into his jacket and pulled out a folded document, actual paper, printed, weatherproofed in a clear sleeve. He held it toward her. She didn't take it yet. "My name is Warren Pratt," he said. "I work in DoD acquisition oversight. I've been embedded in a procurement audit for the last 11 months that intersects with a counterintelligence inquiry that Sergeant Voss's team has been running." He kept holding the document. "The mission records from Carivo Province, 2017, the ones that were altered to reflect a failed extraction caused by poor medical decision-making, those records were falsified by 3 individuals, 2 of whom are still in active departmental positions." The wind screamed around the corner of the HVAC housing. Lauren took the document. She didn't open it. Not here, not in this light and rain, but she held it. "The 3rd individual," Pratt said, "arranged your transfer out of the unit and then ensured your credentialing pathway was disrupted enough that you couldn't pursue a federal medical career. The paper trail we have is strong but circumstantial. Your direct testimony, specifically your account of the communications you received in the 48 hours before the Carivo extraction, would close it." Lauren looked at Voss. Voss said, "I'm sorry. I know this isn't what you signed up for when you came to work here." "Why tonight?" she asked. "Why this building? This way?" "We were 3 weeks from a formal filing," Pratt said. "Someone moved up the timeline. The flight deviation tonight, the storm path the birds were routed through, it wasn't accidental. Someone with access to the operational scheduling tried to put Voss's entire team out of the picture before we could get in front of a review board." Lauren processed this in a second. "And the 2 men downstairs?" "Watching," Pratt said. "Monitoring whether any of us were talking to each other. They don't know I'm up here. They know me as a facilities contractor. I've been in the building for 2 days on a separate cover." That's why Voss came to the roof. That's why. She looked at the document in her hands. Rain was hitting the clear sleeve. Behind her, she heard the roof access door push open, and she turned. Mac, the man with the beard, whose real name she still didn't know, came through, followed closely by Adrienne Sorrell, who looked at Lauren's uncovered left arm with an expression of visible relief and said nothing about it. "We have a problem," Mac said. He wasn't addressing Lauren specifically. He was addressing the roof in general. "Karen Whitmore just called Iron Harbor PD. She told them we have an unauthorized federal presence, and she wants the military patients transported. In this weather, Lauren said, she doesn't understand the weather, or she doesn't care. Mac moved to Voss, put a hand on his shoulder, assessed him the way teammates assess each other. Fast, thorough, trusting the other person to tell them if something's wrong. Can you get back down? Yeah, Voss said. We go down now, Lauren said. She wasn't asking. He's been out here long enough and his temp is dropping. She handed the document back to Pratt. Keep that secure. I'll give you a formal statement when my shift ends. Lauren, Searle started. I have a patient with a chest tube who is standing in 60-mile-per-hour winds, Lauren said. Everything else waits. Nobody argued. Getting Voss back down the 4 flights was slow and required Lauren on one side and Mac on the other, and Voss managed it with the grim competency of someone who'd been trained to push through physical limits and was currently pushing, visibly, past what his body thought was reasonable. He made no sounds that indicated he was enjoying it. His saturation, which she checked with a pocket pulse ox she'd pocketed before leaving the floor, stayed above 90 through the descent, which was the number that mattered. They came back through the 4th floor landing and down to the ER level, and Lauren pushed through the stairwell door to find Deb waiting. Deb looked at Lauren's uncovered arm, at the tattoo, at Voss, at Mac. She took all of this in with the particular composure of a charge nurse who had seen 30 years of unexpected things walk through emergency department doors and had developed a working philosophy of solving immediate problems first and asking questions later. Bay 2 is clear, Deb said. I restocked it. Thank you, Lauren said. Also, Deb added, Dr. Hale is with Whitmore in the administrative corridor. It is not going well for Whitmore. Lauren didn't stop moving. What do you mean? I mean, Hale told her that if she initiated a transport order for medical patients in a Category 2 storm, he would put his personal objection on every document she filed. And then he called the Chief of Staff's emergency line, which he has never done in the 9 years I've worked here. Deb held the bay door. Whatever's happening tonight, something changed in that man. Lauren got Voss back onto the bed. He went down with the controlled fall of someone whose body was finally done negotiating, and his eyes closed for a moment before he pulled them back open. She checked the chest tube drain. Output was acceptable. No frank blood. She replaced the IV connection he'd capped, drew a quick manual pressure because she didn't trust the cuff after the exertion, and started a new set of vitals on the monitor. You have to stop doing things like that, she told him. Noted, he said. I mean it. The chest tube can kink. You can collapse it again. Lying on a wet roof in a gown is not... She stopped herself. He knew. He wasn't a child. Are you in significant pain? Define significant. More than you're showing. A pause. Yeah. She adjusted his analgesia. Not enough to put him under, enough to take the edge off so his body could stop fighting itself. She checked the head lac, still holding, no new bleeding. The head CT was going to happen in the next 15 minutes, or she was going to become extremely difficult about it. Max stood at the bay entrance watching her work, and she was aware of him in the way she'd become aware of all of them tonight. As people with a weight to them, a specific kind of earned gravity that came from having done things that mattered and survived them. Your arm, he said quietly when she moved to the chart. She didn't pull the sleeve down. Yeah, she said. How long have you been here? 3 years? And nobody knew? She looked at him. He was asking a real question, not a rhetorical one. He genuinely wanted to understand how someone hides that effectively for that long, and she considered giving him the real answer, which was, by being exactly what they expected you to be, by never giving them a reason to look harder, by becoming so thoroughly ordinary in their eyes that the idea of a hidden history became literally unimaginable. What she said was, people see what they decide to see. He was quiet for a moment. We should have found you sooner. You found me tonight. She closed the chart. That's what happened. The Iron Harbor PD unit that Whitmore had called arrived at 2:47 in the morning, 2 officers in storm gear who looked like they wanted to be anywhere but driving in a hurricane, and who spent 4 minutes talking to Hale and Deb at the ER entrance before making a second call, presumably to their supervisor, and then spending another 3 minutes after that before accepting a cup of terrible coffee from Priya and settling in to wait for the situation to clarify. Lauren was aware of all of this in the periphery. What was demanding her center was the thing Deb told her at 2:53. The second military helicopter's surviving crew had been staged at a fire station 2 miles east, and the storm had shifted enough that a ground convoy could now move, and they were incoming. 4 more potential patients, which meant Iron Harbor's ER, already stretched and running on backup power in 2 wings, was about to absorb another caseload. She went to Hale. She found him at the administrative corridor entrance, and Karen Whitmore was still there. But something in the geometry of their positioning had changed. Whitmore had the posture of someone who'd been arguing and had run out of the right kind of momentum. Hale was standing straighter than he usually did, which, with his height, put him at a disadvantage in normal social situations and an advantage in this one. 4 more incoming, Lauren said to Hale. She didn't address Whitmore. We need to activate the secondary overflow protocol and get the OR on standby. If any of them have surgical needs, we can't push them to Harwick. Hale pulled out his pager. What's their status? Unknown yet. The convoy's 2 miles out. I want Osei looped in for cardiac, and we need the trauma bay restocked. Bay 2 was used for Voss's secondary setup. I'll call the OR. He moved. Whitmore said, I have not authorized the use of the OR for non-scheduled. Karen. Hale turned. He said her name with a flatness that was worse than volume. I will be calling the Chief of Staff again in approximately 4 minutes to brief him on the incoming patients. If you want to make an administrative objection to the surgical standby, you are welcome to take that up with him directly. Whitmore's mouth closed. Lauren was already walking. She pulled on a fresh pair of gloves, regular ones, no compression, she wasn't hiding anything anymore, and began the mental triage she always ran before a mass casualty influx. Who was where? What was available? Who on staff was sharpest right now? And who was flagging after 6 hours of storm response? Priya was sharp. Ota was holding up. The overnight tech, a heavy-set man named Dunbar, who had been doing this for 15 years, was running the supply corridor with the methodical calm of someone who'd done it in situations twice as bad. The cardiology resident, Osei, was still in the building. She'd stayed because the cath lab had been able to reach Fuchs's blockage, and she wanted to see him into recovery. Lauren found her outside the cath lab recovery bay. I'm going to need you on standby, Lauren said. Military convoy incoming. I don't have their status, but I want a cardiac-capable physician in the ER. Osei blinked. She'd been awake for a long time. I'm a second-year resident. I know. You're also the best diagnostic reader in this building tonight. Lauren held her gaze. You with me? Osei looked at the recovery bay. Fuchs was visible through the window, stable, monitored, his face slack in the specific relief of someone whose heart had been given back to them. Yeah, she said. I'm with you. The convoy arrived at 3:11. 3 military vehicles and an Iron Harbor fire rescue escort pulling into the ambulance bay with their headlights cutting sideways through rain. Lauren was already there. 2 patients were ambulatory. 2 were not. The first non-ambulatory patient was straightforward. A fracture dislocation of the left ankle, painful and in need of imaging and orthopedic management, but not life-threatening. Lauren triaged him to Bay 4 and moved. The second non-ambulatory patient was the problem. She knew it the moment the stretcher came through the doors, because she could hear the breathing before she could see the person. A wet, labored sound, the kind of sound lungs make when fluid is doing something it shouldn't. The paramedic crew that had ridden from the fire station handed off fast, penetrating injury, left chest, field dressed. Patient had declined twice during transport, been resuscitated once. Lauren looked at the patient. Female, early 30s. The field dressing on the left thorax was inadequate. It was a buster seal, proper in concept, but the application was angled wrong and one corner had lifted, creating a partial flutter valve instead of a closed seal. She reseated the seal before the stretcher stopped moving. Bay 1, she said. Someone get Hale now. And I need a fast exam. Ultrasound to me. She worked while she waited, her hands on the patient's chest, her eyes on the face. The patient was conscious, barely, her eyes unfocused and tracking wrong. Penetrating trauma to the left chest meant cardiac tamponade was on the table until proved otherwise. The ultrasound came on a rolling cart. Lauren positioned the probe herself. The image showed exactly what she'd feared: fluid in the pericardial space. Not massive, not yet, but the heart was working against compression, and the tracing on the monitor was showing the paradoxical pulse pattern of early tamponade. Hale arrived at a jog. Pericardial effusion, early tamponade, penetrating mechanism, Lauren said, not looking away from the screen. We need a pericardiocentesis. Hale looked at the screen, looked at the patient. Agreed. He reached for the echo probe. She handed it without comment and moved to position the kit. Pericardiocentesis was a procedure she had done in the field, and he had done in controlled hospital settings, and they had entirely different relationships to the associated anxiety. She set the kit up in 30 seconds, prepped the site, handed him the needle. His hands were steadier now than they'd been earlier in the night. She noted this. Syringe? He said. She handed it. He aspirated fluid, dark, non-pulsatile, the characteristic appearance of pericardial blood. The tracing on the monitor shifted almost immediately. The patient's eyes focused. Okay, the patient said, which was not a clinical response but was a human one, and Lauren registered it as such. You're okay, Lauren said. We've got you. She had said this twice tonight to two different people, and both times she'd meant it, and both times it had been true. And she understood that this was the center of what she did, not the procedures, not the tactical knowledge, not the things that set her apart, but the simple act of showing up to the worst moment of someone's day and meaning it when she said, "You're okay, we've got you." Around her, the ER had reorganized itself again, absorbing the new influx, sorting and stabilizing and managing. Osei was in the second bay with a patient who'd been complaining of chest pressure since the convoy arrived. Odo was managing the ankle fracture with a calmness that had not been there 6 hours ago. Deb was running the charge desk with the competence of someone who had 10 things in her head simultaneously and was holding all of them. Lauren moved through it all, and she was aware, for the first time in 3 years, aware with specific clarity rather than resigned habit, that she was not just surviving the shift. She was running it, not with authority she'd claimed or been handed, but with the kind of authority that emerges when someone knows the situation better than anyone else in the room and simply acts on that knowledge. The two officers from Iron Harbor PD had graduated from skeptical observers to useful presences. One of them was helping manage the waiting area. The other had gone to the supply corridor to assist Dunbar with a heavy equipment move. They'd made their second call to their supervisor around 3 a.m, and the supervisor had apparently said something along the lines of, "Just help the hospital," and so they were. Sorrell appeared at Lauren's side around 3:30 in the relative quiet between the trauma bay work and the next anticipated problem. Pratt has a secure line to the review board, she said, low. If you give him a preliminary statement, just the key points from Carivo, he can file tonight before the people who arranged that flight deviation have time to cover. I'm in the middle of a shift. I know, 20 minutes. The family consultation room. Sorrell paused. The tamponade patient is stable. Hale is with the ankle case. Osei has Bay 2. You have a 20-minute window and you know it. Lauren looked at the floor plan in her head. The staffing, the patient statuses, the most likely complications in the next 30 minutes and who was positioned to handle them. Sorrell was right. She had a window. 15 minutes, Lauren said. Ike. Warren Pratt had a tablet and a secure audio recorder, and he moved through his questions with the brisk economy of someone who had done this before, not in a way that felt clinical, but in a way that felt like he understood the difference between what he needed and what he was putting her through to get it. Lauren sat across from him in the family consultation room, and she talked. She talked about Carivo Province. She talked about the 48 hours before the extraction, the communication she'd received that contradicted the official operation timeline, the orders she'd been given verbally that never appeared in the written record, the medical decisions she'd made in the field that she stood behind, that she had always stood behind even when the record was altered to say otherwise. She talked about the morning she was told her unit transfer had been processed, and the specific language the officer had used, language she had memorized because even in the shock of it, She had understood that it was covering something, that the casualness of it was performance. She talked about the credential disruption, the references that didn't come through, the licensing board delays that had no clear cause but were consistent enough over 18 months to be a pattern. She talked, and Pratt recorded, and when she was done, her throat was dry, and her hands were flat on the table in front of her, and the room was very quiet. "That's enough," Pratt said. "That's more than enough. Is it going to hold?" Combined with what Voss's team has documented and the flight deviation evidence from tonight, yes, this holds. He stopped the recording. "You understand that this becomes a formal inquiry. There will be hearings. It will be public." She'd known that. She'd known it the minute she picked up the flip phone. "Okay," she said. She stood up. She had 11 minutes before her window closed. Pratt was packing the tablet when he said, "I need to tell you something. The third individual, the one who arranged the transfer and the credential disruption." She waited. "He's not distant," Pratt said. "He's been involved in the procurement pathway for 3 regional hospital systems, including Iron Harbor's federal emergency contract." He looked at her steadily. "He has relationships here, recent ones." Lauren felt the room shift slightly. "What's his name?" she said. Pratt picked up the tablet. "Gerald Fouche." The name hit her like cold water. She stood very still. Retired schoolteacher, blood pressure 168/102. Drove himself to the ER because he didn't want to be a bother. The man she had spent the last 3 hours trying to save. She said, "That's not possible." His civilian cover is a retired schoolteacher. His actual background is 18 years in DoD acquisition, working specifically in contract oversight for federal medical facilities. He retired from that role nominally. He did not retire from the activity. Pratt met her eyes. His presence here tonight, the storm, the chest pain, the self-presentation as a civilian in crisis, we need to know if it was coincidental or operational. Lauren thought about his blood pressure, his EKG, the NSTEMI presentation. The way he'd looked at her. "You're the one who caught it. The numbers caught it. I just read them." She thought about whether you could fake a NSTEMI, whether the EKG changes could be induced, whether someone with 18 years in operational environments would know how to present specific symptoms to a specific emergency department on a specific night. She thought about his question to her in the bay. "Am I going to make it through tonight?" And the look on his face when he asked it, which she had read as stoic fear and which she now did not know how to read at all. She said, "Where is he now?" "Cath lab recovery." She was already at the door. "Lauren," Pratt's voice stopped her. "If he's operational, he is not safe to approach alone." She turned. Her hand was on the frame. Her left arm was visible, the tattoo clear under the fluorescent light. And she looked at Pratt with the expression of someone who has just finished giving a statement about surviving things that were supposed to end her, and said, "I've been alone in this building for 3 years." She went out the door. She moved fast through the corridor toward the cath lab recovery bay, past the hum of equipment and the murmur of night shift voices, past the window where the storm was still throwing itself at the glass, past every version of herself that had kept her head down and her sleeves down and her past buried. She pushed open the recovery bay door. Gerald Fouche's bed was empty. The monitor leads were draped neatly over the bed rail. The IV had been disconnected at the port, the same clean cap method as Voss, and the nasal cannula oxygen had been removed and placed precisely on the pillow. On the bedside table, next to an untouched cup of water, was a single folded piece of paper. Lauren picked it up. It was a photograph, printed on standard paper, the kind that came from a portable printer. The image was a surveillance still, time-stamped from 6 weeks ago, showing Lauren in her hospital scrubs, taken from a position outside the building, through the window of the break room. Someone had been watching her for 6 weeks, and on the back of the photograph, in the same pen as the gauze message on the roof, were 2 words, "Not yet." Her chest was absolutely still for 1 full second. Then her radio badge crackled, and Deb's voice came through tight and fast. "Hayes, I need you back on the floor. Right now." She didn't answer right away. She was looking at the photograph, at the timestamp, at the angle of the surveillance position, which she could read from the window framing and the shadow direction. The angle was from inside the parking structure across the street, the parking structure that had a connecting tunnel to Iron Harbor Medical Center's basement level, a tunnel that almost no one on staff knew existed. Lauren put the photograph in her pocket, next to the flip phone, next to the gauze with ROOF written on it, next to everything that had accumulated tonight into a weight she had not set down. She pressed the radio badge. "On my way," she said. And she started moving, and she did not know yet whether the man she had saved tonight was a victim or a weapon or something worse than both. And she did not know who had taken his photograph of her, or who had sent it, or what not yet meant as a message or a threat or a warning. What she knew was that there was a tunnel in the basement that went somewhere, and that someone who knew how to disappear from a cath lab recovery bay after a cardiac procedure knew about it. And that knowledge was the kind that required immediate and very specific action. She was 4 steps from the elevator when the lights went out again. All of them, backup and primary both, every circuit in the building. A darkness so total it felt pressurized. And from somewhere below her, deep in the building structure, she heard a sound that was not the storm. It was a door. And then it was footsteps. And then the lights came back on, and Lauren was standing in the corridor with her left arm uncovered and her hand pressed against the wall and her eyes locked on the elevator panel, watching the floor indicator count upward from B1. Someone was coming up from the basement. The elevator indicator stopped at 2. Lauren watched it. The floor above the ER level, which held administrative offices, a radiology annex, and a conference suite that had been empty since 8 o'clock when the last non-essential staff evacuated ahead of the storm's peak. Nobody had a reason to come from B1 to the second floor at 3:40 in the morning. Nobody with a legitimate reason. She was already moving when the elevator doors opened, not toward them, away, cutting through the side corridor that ran parallel to the main hall, the one that maintenance used because it shaved 30 seconds off the supply run, and that Lauren had learned in her first 6 months because she was always looking for the path that got her where she needed to go without going through the center of things. She took the stairs to 2. The second floor was dark in the way of spaces that aren't on emergency circuit. The exit signs threw enough red to navigate by, and the windows at the hall's end were lit strangely by the storm, the cloud cover bouncing the city's remaining light in a diffuse silver that made everything look like an old photograph. She heard voices before she reached the main corridor, 2 of them. One she didn't recognize, one she did. Karen Whitmore. Lauren stopped at the stair door and listened through the gap she'd left it open. Said it would be contained by now. Whitmore's voice, stripped of the managerial composure she wore downstairs. What was underneath was tighter, frightened and angry in equal measure, the specific combination of someone who understood they were in something they didn't fully control. The other voice was male, older, unhurried. The situation changed. The flight deviation didn't achieve what it was supposed to achieve because your nursing staff intervened. Lauren's jaw set. "I didn't know about the flight," Whitmore said. "I want that understood. Nobody told me. What you knew and when is not my concern right now. My concern is the man who's in that building with a recorder and a secure line." A pause. "Pratt?" Whitmore was quiet for a moment, then, "How did Pratt get access to the building?" "Through a facilities cover I arranged before the storm. I didn't anticipate he'd use it to conduct a preliminary filing." Another pause. "I need the hospital's internal communication logs for tonight. Everything from the federal contract server, specifically the overnight channels. I can't pull those without authorization. You have authorization. You're the administrator of record." The voice was patient in the way of someone who'd had this conversation many times and found the resistance tedious. "Karen, we've been through too much for you to develop a conscience now." A long silence. Lauren pressed the door open another half-inch. She could see them. Whitmore in her storm-damp blazer, arms crossed, standing near the window. The man with her was tall, silver-haired, with his back partially to Lauren. She didn't recognize the posture, didn't recognize the coat, but she recognized the voice. She'd heard it twice tonight, briefly, in a recording that Pratt had played her from the operational intercept. a voice giving verbal authorization for a training flight deviation in a weather corridor that no one in the chain of command had signed off on. She had the flip phone in her pocket. She pulled it out and navigated to the single contact. Not Sorrel this time. Sorrel had given her a second number, below the first, labeled only with a time, 3 o'clock plus. She pressed it now. Mac picked up in 2 rings. She said nothing. She just held the phone toward the door gap. Mac said, "Copy." She closed the phone. She stood in the stairwell and waited, and she kept the door at the same angle, and she listened to Whitmore and the man with the silver hair negotiate the specific logistics of covering something that was already uncovering itself. And she thought about the photograph in her pocket with its timestamp and its message, and the surveillance angle from the parking structure. 6 weeks. Someone had been watching her for 6 weeks, and she hadn't known. 3 years of careful invisibility, and in the end, it hadn't been enough, which meant that whoever had arranged her professional burial had always kept a monitoring thread on where she ended up, and the thread had pulled tight when Voss's team started getting close. The man with the silver hair said, "The nurse, the one Duval's people are calling Echo." Whitmore was very still. "What about her?" "She gave a statement tonight. I need to know what she said." I wasn't in that room." "You have security footage of the family consultation room." Another silence. This one had a different quality. Whitmore was recalculating something. Lauren could feel it even through the door. "I'm not going to pull security footage of a staff member," Whitmore said. The surprise of it landed quietly. Lauren kept her expression level. "Karen, I'll get you the communication logs. That's what you need for the filing timeline. But I'm not surveilling my own nurses." Whitmore's voice had found a floor it hadn't had before. Thin, unstable, but there. "There's a line. You moved that line 3 years ago when you agreed to flag her credentialing issues upward. I flagged a personnel question. I didn't—" Whitmore stopped. "I didn't know what she was. I didn't know what any of it was. I thought it was a standard background concern. And now?" Silence. "Now she kept 6 people alive tonight," Whitmore said. "So whatever she is, the line is there." Lauren pulled back from the door. She stood in the red-lit stairwell with her back against the concrete wall, and her left arm visible, and her mind running fast through what she'd just heard, sorting it into what was useful, and what was noise, and what was something she hadn't expected. Karen Whitmore was not clean. She never had been. But there was a difference between a bureaucrat who agreed to look away and one who'd built the mechanism, and that difference mattered, and it was going to matter more in the next few hours than it had in the last 3 years. She went back down to the ER. Mac was at the charge desk when she came through the door, and Sorrel was next to him, and both of them had the compressed efficiency of people who had been moving fast in her absence. "We got it," Mac said. Quiet, but certain. "All of it?" "Enough." The phone bridge picked up 18 minutes of the conversation, combined with Pratt's recording of your statement and the flight deviation intercept. "We have 3 independent evidentiary threads." He held her gaze. Pratt filed the preliminary at 3:52. It's time-stamped and logged with the review board. Lauren let that settle. "Who is he?" she asked. "The man upstairs with Whitmore." Sorrel answered. "His name is Douglas Marin, retired admiral, currently serving as a senior advisor to the DoD Oversight Committee, the same committee that would have reviewed the Carivo records if they'd ever reached formal inquiry." She paused. "He's been sitting on the evidence for 4 years. The shape of it assembled in Lauren's mind with the particular clarity of things that were ugly but coherent. An oversight committee advisor who had the authority to bury inquiries before they opened. A hospital administrator who'd agreed to flag credentialing concerns without knowing their origin. A procurement contractor with an 18-year operational background who'd ended up in her ER with chest pain on the same night his former assets military operators crashed 2 miles away. "Foosh," she said. "Where is he?" "We found him," Sorrel said. "He's in the building, basement level, the old storage corridor off the tunnel access. He didn't get far. The tunnel locks from the outside after the storm protocol kicks in, and nobody told him that." She paused. "He's also in considerably more discomfort than a man faking a cardiac event should be." Lauren looked at her. The NSTEMI was real, Sorrell said. Pratt was wrong about Fuchs's role, or partially wrong. Fuchs was operational, yes, but he's been out of active work for 2 years. He came to the ER tonight because he was having a genuine cardiac event. And somewhere in the middle of being treated, he recognized your name from the personnel file Marin had shared with him years ago. Sorrell's expression was precise, giving her only what was accurate. He left because he panicked. The photograph and the note were not a threat. He was warning you. Lauren said, "Not yet" was a warning. He knew Marin was in the building. He didn't know how to approach you directly without compromising both of you, so he left me a cryptic note on a piece of paper and disappeared into a locked basement. She rubbed her face with one hand. He needs to go back to a monitored bed. The pericardiocentesis that I performed earlier was on a different patient, but Fauch had his own cardiac event, and if he's been walking around, he's ambulatory but symptomatic, Sorrell said. Deb is handling the retrieval with one of the PD officers. Lauren turned to the charge desk. The ER's current patient load was distributed across 8 occupied bays, all of them monitored, all of them stable in the sense of not actively deteriorating. The 2 new arrivals from the second convoy had been assessed and managed. Voss was in Bay 2, resting. The tamponade patient, whose name she still didn't know, which bothered her, was in Bay 7, upgraded to stable, her pressure holding. It was 4:08 in the morning. The storm's peak had passed around 3:30, according to the weather alert that had come through the hospital's emergency notification system. What remained was still severe. The wind hadn't dropped below 40 and the rain was horizontal, but the structural worst was done. Marin is still upstairs, Lauren said. Marin doesn't know the filing went through, Max said. He thinks he has until morning to manage the situation. Then we have a window. We have a window, Mac agreed. Lauren looked at the corridor, at the elevator, at the stairwell door. She thought about 3 years of inventory in a supply corridor, 3 years of compression gloves and lowered eyes and acting like one, 3 years of being precisely what Preston Hale expected her to be, which was small, which was manageable, which was the version of a person that systems find easiest to ignore. She thought about the tattoo on her arm, visible now, and how it felt to stop hiding it. I'm going to need Hale, she said. Mac looked at her. For what? For this next part. She was already moving toward the trauma bay where Hale had been managing the ankle fracture case. Because what happens upstairs is going to come downstairs, and when it does, the medical authority in this building needs to be positioned correctly. She found Hale finishing a splint application on the ankle patient, a young specialist named Burroughs who had been remarkably calm about his injury and was currently describing the moment the helicopter hit the ground with the detached narrative clarity of someone in moderate shock who didn't know it yet. I need 5 minutes, Lauren said from the bay entrance. Hale looked up. He assessed her, arm, expression, the absence of the gloves, in the fast professional way he had that she'd always resented and now found she could simply use. Priya, he said, finish wrapping and get Dr. Oda to sign off on the imaging. Priya nodded. Hale came to the bay entrance. Lauren told him about Marin. She told him about Whitmore. She gave him the core of it in 90 seconds. Not everything. Not the Carivo history. Not the personal weight of it. Just the operational shape. A senior DOD official was on the second floor of his hospital attempting to extract internal communications in order to obstruct a federal inquiry that had been filed 40 minutes ago. Hale was quiet for a moment. Whitmore let him in, he said. She met with him. I don't think she controls the situation anymore. He was quiet again. She could see him processing the institutional dimension, what this meant for the hospital, for the morning, for the version of Iron Harbor Medical Center that would exist after tonight. The chief of staff, he said. Yes. I'll call him now. He reached for his pager, stopped, looked at her. Is she going to be all right? Whitmore. The question surprised her. Not its content. She'd been working through the same calculation, but its source. That depends on how she handles the next hour, Lauren said. He nodded. I'll call Harmon. He moved. Lauren went back to the charge desk and picked up the landline, because there were some calls you didn't want going through a hospital radio system, and she called Sorrel on the flip phone first to coordinate, and then she sat down in the chair behind the charge desk, which was Deb's chair technically, but Deb was managing the Fouche retrieval and the chair was empty. And she put her hands flat on the desk and breathed. She hadn't done that in hours. Just breathed, with intention. Her left forearm was on the desk, visible, the tattoo under the fluorescent light. She looked at it. The ink was dark and clean and 7 years old, placed by a medic named Driscoll, who'd been killed 8 months after he put it on her, in a separate engagement in a separate country, and who had told her when he did it that call signs were earned, not given, and that echo meant something specific. It meant that in the chaos of active contact, you were the voice that came back, the one that confirmed the signal, the one that told the team they had been heard. Echo. She had spent 3 years trying not to be that. She looked up from the tattoo. Deb was coming through the ambulance bay doors with Officer Calhoun, the more practical of the two PD officers, and between them, moving slowly and with the careful deliberateness of someone whose chest hurt and who was not going to admit it fully, was Gerald Fouche. He looked up when he entered and found Lauren immediately. She held his gaze. He had the expression of a man who understood exactly what he'd put in motion and was not sure he'd earned the right to be sorry about it. Not contrition, something more complicated. The face of someone who'd spent years on the operational edge of things he'd told himself were necessary and was reckoning with what necessary had cost. She stood up from Deb's chair. "Bay 6, she told Deb. "Get me a 12 lead and a troponin panel." Fouche said, "Lauren, you can talk after I make sure you're not going to die in my hallway." She moved toward Bay 6. He followed, slowly, Calhoun staying at a respectful distance. "Sit down on the bed." He sat. She started the 12 lead herself. He watched her hands on the electrode patches. "The photograph," he said. "I need you to know that I took it to document your location, for my own record. I wasn't feeding it to Marin." "I know," she said. "You came here tonight because you had a cardiac event, and you ended up in my ER by chance. But when you recognized my name, you understood what it meant that Voss's team had crashed nearby." She peeled the backing off an electrode. "You panicked. You left because you thought staying was worse than going. It was more complicated than everything always is." She pressed the electrode to his chest. "The note on the photograph. Not yet. You were telling me Marin was in the building and wasn't ready to move yet. You wanted me to have time." He looked at her for a long moment. The EKG machine was warming up, drawing the baseline. His face was gray in the particular way of cardiac patients who'd been ambulatory longer than they should have been. "I did a lot of things I can't take back," he said. "The review board will sort that out." She wasn't cold about it. She also wasn't merciful in the way of someone who decided to forgive him before the evidence was examined. She was simply honest. "Right now your job is to stay in this bed." He nodded. He put his head back against the pillow. The 12 lead began printing. She looked at the readout and found what she expected. Evolving changes, the kind that said the stent placed by Osei's cath team had been adequate, but that the patient had subsequently climbed around a hospital basement in a cardiovascular event and done himself no favors. She flagged the strip and called Osei. Osei was there in 4 minutes. Lauren gave her the handoff and stepped back, and in the stepping back she became aware that the corridor outside Bay 6 had gotten crowded. Sorrel was there, Mac was there, the 2 PD officers were there, and now there was a third one, a sergeant, from the rank insignia, who had arrived in the last 10 minutes, and who was standing near the nursing station with the particular posture of someone who'd received a call from above their usual pay grade and was waiting to understand what it required of them. And coming from the elevator, Hale, with his phone still in his hand and his coat slightly disheveled in a way she'd never seen on him, which meant the call to the chief of staff had been both brief and consequential. And behind Hale, moving with the directed ease of someone who had made a decision and was living with it, was Karen Whitmore. Whitmore's composure was the worked kind, the kind you maintain because the alternative is worse, not because you feel it. Her eyes found Lauren across the corridor and held. Lauren held back. Whitmore said to the sergeant, "I need to report an unauthorized individual on the hospital's 2nd floor. His name is Douglas Marin, and he is accessing internal hospital communications without valid medical or administrative authorization. The sergeant looked at his officers, looked at Whitmore, looked at the general organized urgency of the ER around him. "Ma'am," he said, "can you show us where?" "Yes," Whitmore said. "I can." She walked to the elevator and pressed the call button, and the sergeant and one of the officers followed, and Lauren watched the doors close on Karen Whitmore's carefully maintained face and thought about lines, where they actually were, and what it cost to find them, and the specific kind of courage that wasn't dramatic but was simply the decision to stop, even late, even damaged, even when it was expensive. The other PD officer stayed on the ER floor, which was protocol. Mac appeared at Lauren's shoulder. "That was unexpected." "Somewhat," Lauren said. "You think she'll hold up?" "I think she's more afraid of what she didn't do than what she did." She watched the elevator indicator. "That's usually enough." Douglas Marin was found on the second floor at 4:31 in the morning. Lauren wasn't there for it. She was in the ER, where she belonged, managing the floor through the final hours of the storm. She heard the account afterward, from the sergeant, who was professionally brief about it, that Marin had been located in the administrative conference suite with a hospital-issued laptop and an external drive, and that he had not resisted, which suggested he understood that the moment for resistance had passed. He was calm, by the sergeant's account. Composed. Lauren thought about a man who spent his career making things disappear and had come to the specific moment where nothing else would disappear, and she thought that the composure of that kind of person was not the same as innocence. It was the composure of someone who had always known, somewhere, that the accounting was eventual. That you didn't bury things permanently, you only buried them long enough. At 5:15, Voss's CT results came back clean. No intracranial involvement, no delayed bleeding. His chest tube output had decreased to the acceptable range. His saturation was 97. She went in to tell him. He was awake, had been awake, she thought, for most of the last hour. He was looking at the ceiling with the particular stillness of someone running through things. "Good news," she said. "Your head is structurally intact." "That's debatable," he said. She almost smiled. "The brain scan specifically. Everything else is between you and the people who know you." He turned his head to look at her. At her arm. "It's done?" Pratt filed at 3:52. Marin is in custody as of about 40 minutes ago. She checked the drain. "It started. Whether it's done takes longer." He was quiet for a moment. "Your career, the things they did to it. That's for the review board. I know, but I want you to know." He stopped. Started again. "We should have pushed harder to find you. After Carivo, when the record came out wrong, we should have pushed." She looked at him. He meant it. That was the thing about it. He genuinely meant it, and it wasn't going to make the 3 years different, and he knew that, and he was saying it anyway because it was true, and it needed to be said. "You came through a hurricane," she said. "That's pushing fairly hard." He exhaled, something between a laugh and a wince from the chest tube. "The team wants to come in, Mac and the others. Is that—" "One at a time, and no one leans on the bed." She moved to the door. "Echo," he said. She stopped. The word still had weight. It probably always would. "Thank you," Voss said. She stood in the doorway for a moment. The ER behind her was the quiet hum of a long night settling toward morning. The kind of quiet that is not peaceful exactly, but earned. "Get some sleep," she said. She went back to the floor. It was 5:22 in the morning. Outside, the storm was breaking. The rain had dropped from horizontal to diagonal, which was the storm's way of conceding. The sky beyond the eastern windows had the first gray suggestion of something other than dark. Lauren stood at the nurse's station and looked at the board, every name on it, every status. She was writing a note in Fuchsia's chart when Hale appeared next to her. He stood there for a moment, not saying anything, looking at the board the way she was. Then he said, "The chief of staff is coming in at 6. He's going to want a full account of the night." "I know. He's going to ask about you specifically." "I know that too." A pause. "What do you want me to tell him?" Hale said. She looked up from the chart. Hale was looking at her with the expression she'd seen building in him since 2 in the morning. The one that was not quite guilt and not quite respect, but occupied the uncomfortable space between them, where a person lived when they understood they'd been wrong about something for a long time and were still assembling the full shape of it. She thought about the right answer. She thought about what she'd actually want from this conversation if she were being honest about it. "Tell him what happened," she said. "Everything that happened. Don't clean it up." He nodded once. She went back to the chart. She was 3 lines further into the documentation when Deb appeared at the corridor entrance, moving fast, with the expression Lauren had learned to read as not a crisis, but close. "What?" Lauren said. "Conference room 2, Karen Whitmore." Deb's voice was careful. "The sergeant just brought her back down. Marin said something to her before they took him out. She won't say what it was. She's—" Deb paused, searching. "She's asking for you." Lauren set down the pen. She looked at the corridor leading to conference room 2, at the distance between here and there, at all the reasons not to walk it. She picked up the pen, finished the line she'd been on, then she set it down again and walked. Conference room 2 was small, smaller than the family consultation room. No tissues on the table, no effort at comfort. It was used for shift briefings and administrative reviews and the occasional difficult personnel conversation. Whitmore was sitting at the end of the table, both hands flat in front of her, and she looked like something had been removed from her recently, some structural element that had been holding a particular shape in place. Lauren sat down across from her. Whitmore said, "He told me your name was in the original complaint, the one that started your credential disruption." She paused. "He said the person who filed it was me." Lauren kept her face even. "I filed a personnel background concern," Whitmore said. "I filed it because I was told it was a standard retention flag for someone with a military background who hadn't fully cleared their federal contract eligibility." She was speaking carefully, the way people speak when they are trying to be precise about something they can no longer afford to be vague about. "I didn't know what it would be used for. I didn't know your name was attached. She stopped. "That is not an excuse. I know that." Lauren said, "What did he say to you exactly, before they took him?" He said, Whitmore's hands pressed harder against the table. He said, "It only worked because you signed it." The room was very quiet. "He's right," Whitmore said. "Whatever I understood or didn't understand at the time, I signed a document that was used to harm someone, and that person was in this building for 3 years without me ever—" She stopped again. A longer stop this time. "Without me seeing her." Lauren looked at her. Whitmore looked back. "I don't need an apology right now," Lauren said. "I need you to give the chief of staff and the review board a complete account of everything you signed and everything you were told, and I need you to do that without managing the way it looks for the hospital. It's going to be bad for the hospital." "Yes," Lauren said. "It is." Whitmore was quiet. Then, "I tried to transfer the patients tonight, during the height of the storm." "I know. If Hale hadn't pushed back—" "But he did." She said it without softness and without cruelty, and Whitmore absorbed it the way people absorb things that are accurate, which is quietly and without argument. Lauren stood up. "The review board inquiry will contact you," she said. "Have your documentation ready." She went to the door. Behind her, Whitmore said, "I should have seen her." Lauren paused in the frame. She didn't turn. "A lot of people should have," she said. She walked back to the floor. The sky through the eastern windows was definitively lighter now. Not sunrise yet, but the preliminary of it. The gray becoming silver, the silver becoming something warmer at the edges, the storm's residue breaking into the kind of ragged cloud cover that moved fast and let things through. Lauren stood at the nursing station and looked at the board, and the board was, for the first time all night, fully caught up. Every patient documented, every status accurate, every decision made and recorded and standing on its own. She became aware, at the edge of her vision, that she was not alone at the station. Ota was there, charting. Priya was at the medication cart. Deb was on the phone. Dunbar was moving something down the supply corridor with the particular patient methodicalness she'd come to associate specifically with him. The floor was not hers alone. It had never been. What had changed was that no one in it was looking through her tonight, and she could feel the difference, and the difference had a specific weight. Not comfort exactly, but something more durable than comfort. She picked up the pen and started on the last piece of documentation. She was nearly finished when the elevator opened and the sergeant came through with two people Lauren didn't recognize. Federal identification, visible badges, the particular kind of controlled entry that meant the morning she'd expected was arriving ahead of schedule. They crossed the floor to the nursing station. One of them, a woman in her 40s with a federal service lanyard, looked at Lauren. "Lauren Hayes?" "Yes," Lauren said. "We've been asked to inform you that a preliminary inquiry under federal review case number 2024-DOD-CR-0091 has been officially opened as of 4:01 this morning, and that your testimony has been logged and received." She paused. "We've also been asked to inform you that effective immediately, your military service record is under administrative review for correction." Lauren held the pen. The agent looked at her arm, at the tattoo, at the way Lauren Hayes stood at a nursing station at 5:40 in the morning after the longest night of her recent life, pen in hand, documentation nearly complete, wearing her history on her skin. "Is there anything you need?" the agent asked. Lauren looked at the board, at the patients, at the floor she'd been managing for the last 9 hours. "I need," she said carefully, "about 15 more minutes to finish this chart." The agent blinked. Then she said, "Of course." Lauren looked back at the documentation. She wrote the last 3 lines. She reviewed them. She signed her name. And somewhere across the floor in Bay 2, a monitor gave a single steady tone that meant everything was holding. And the morning came through the eastern windows in pieces, gold and pale, the storm finally giving way to something that hadn't been there yesterday. The board was clear. The night was almost done. And Lauren Hayes stood at the center of it, with her left arm bare and her name signed and her record about to mean something again. And she felt the floor under her feet, and the pen in her hand, and the specific ordinary weight of a shift ending in a hospital that was still standing. And she let herself, just briefly, without performance and without explanation, feel the full size of what she had not let go. Then Deb said, "Hayes, Bay 3 needs a vitals recheck." "On it," Lauren said, and she went. The patient in Bay 3 was a 67-year-old woman named Dorothea Birch, who had been brought in during the storm's second band with a laceration to her forearm from a shattered window, and who had since been sutured, medicated, and largely ignored because her vital signs were stable and the rest of the floor had been considerably more demanding. Lauren checked her pressure, her pulse, her oxygen, made a note in the chart. Mrs. Birch watched her with the sharp, observant eyes of someone who had been lying in a hospital bed for several hours with nothing to do but pay attention to what was happening around her. "You're the one they've been talking about," Mrs. Birch said. Lauren finished the notation. "People talk about everyone eventually. Not like this." The woman's eyes moved to Lauren's left arm, to the tattoo, without apology or embarrassment. "My son was military, 22 years. Lauren capped the pen. "Is he out now?" "He is." A pause. "He said people like you don't leave. He said you carry it different from civilians. Something in how you move." She considered Lauren for a moment. He was right. Lauren looked at her, at the neat suture line on her forearm, at the dry blood that the trauma team had cleaned imperfectly because they'd been moving fast. She got a damp cloth from the bedside kit and cleaned the area more thoroughly because it was the right thing to do and no one had done it yet. "Thank you," Mrs. Birch said. Not for the cloth, for something larger, gestured at rather than named. Lauren didn't deflect it. She accepted it in the simple way of someone who had stopped needing to minimize every acknowledgement in order to stay invisible. "Get some rest," she said. "Someone will check on you in an hour." She moved back to the station. The chief of staff arrived at 6:12. Dr. Raymond Harmon was 70 years old and had the specific gravity of a man who had run a hospital for longer than most of his current staff had been alive, and who had long since stopped being interested in how things looked and had become focused entirely on how they were. He came through the ER entrance with his coat over his arm and his reading glasses already in his hand, and he went directly to Hale, who was at the charge desk, and the two of them spoke for 4 minutes in the low, deliberate register of people exchanging information rather than managing a situation. Then Harmon walked the floor. He stopped at each occupied bay. He looked at charts. He spoke to Deb, to Oda, to Priya. He looked at the board. He came to Lauren last. She was at the medication station, running the morning handoff count that needed to be done before the day shift arrived, which was in 48 minutes. Dr. Hale tells me you ran this floor for most of the night, Harmon said. Dr. Hale ran the floor, Lauren said. I managed patient care. Harmon looked at her. He was old enough to hear the distinction and understand what it cost her to make it instead of just accepting the credit. He also tells me that he didn't see you correctly, Harmon said. For 3 years. She kept counting. That's his assessment, she said. Is it wrong? She stopped counting. She looked at Harmon directly because he was a man who deserved directness, and she was done with anything else. No, she said. It's not wrong. He absorbed this without flinching. He had the face of someone who had received a great deal of difficult information over the course of a career and had learned that flinching was a response you could choose not to have. The federal agents have briefed me on the inquiry, he said, and on the role that certain administrative decisions at this institution played in your situation over the past 3 years. He paused. I want to be clear that I did not have knowledge of those decisions. I also want to be clear that not having knowledge is not the same as not being responsible for the environment in which they were made. Lauren said, What does that mean practically? It means I'm initiating an internal review of personnel procedures, starting with credentialing and background flagging. He held her gaze. It means Mrs. Whitmore's role in this institution is under review, and she has been asked to cooperate fully with the federal inquiry, which I'm told she has agreed to do. Another pause. And it means that I want to talk to you, not today, not on the other side of a 12-hour shift, about what you need from this institution going forward. Lauren looked at the medication count she'd been running. I'll finish my shift first, she said. Harmon almost smiled. It wasn't quite there, but it was close, and it looked genuine. Of course. He moved away. Lauren finished the count. The morning handoff happened at 7, and the day shift came in to a floor that was controlled but clearly carrying the weight of what had happened. The military patients in their consolidated bays, the storm debris of rapid decisions visible in the chart notes, and the supply cart arrangements, and the particular tiredness on the night staff's faces that was not the ordinary kind. Lauren gave her handoff to the day charge nurse, a methodical man named Collins, who asked exactly the right questions, and wrote down everything she said, and then she stood at the station for a moment after he moved on, looking at the board. She was aware of Hale beside her before he said anything. He had been near her at variable distances for most of the last 2 hours, not hovering, not performing, just present in the way of someone who was working something out and didn't know yet what it would look like when he was done. I put your name on the overnight clinical summary, he said, as co-managing clinician. She turned to look at him. You're a nurse, he said. I know what that means procedurally. I know it's not standard. He met her eyes. I also know that what happened in this building tonight was not standard, and that the person most responsible for the outcome of every critical case we saw was standing next to me the entire time, and the summary should reflect that. It was not a smooth thing to say. He said it with the grain of it showing, the way honest things usually sound when someone isn't practiced at delivering them. Thank you, Lauren said. He nodded once. He looked like he wanted to say more and decided, correctly, that he had said the thing that mattered and adding to it would only reduce it. He went to finish his own handoff. Lauren pulled on her jacket, the one she'd left in her locker at the start of the shift, 16 hours ago, and she was at the locker room door when Priya caught up with her. Priya was 26 and had been a nurse for 14 months and had grabbed Lauren's arm in the trauma bay early in the night and had spent the subsequent hours recalibrating that moment in her own mind. Lauren could see it in the way she approached. Direct, not shuffling, making herself do the thing directly. I'm sorry, Priya said. In trauma too. You were following protocol, Lauren said. I was following a reflex, Priya said. That's different. I didn't think about whether you were right. I thought about hierarchy. She paused. The patient would have died if you'd waited. We don't know that for certain. I think we do. Priya held her gaze. I want to know how you knew. The needle, the placement, the timing. I want to know how you get that fast. Lauren looked at her, at the genuine hunger in the question, not the kind that wanted to be impressive, but the kind that wanted to be better, the kind she recognized from a version of herself that was a long time ago. Buy a textbook called Tactical Emergency Care, Lauren said. It's used in military medicine. Work through the procedural chapters until the movements are in your hands, not just your head. She paused. And stop letting the room tell you who gets to act. Priya absorbed this. Okay, she said. Lauren went through the locker room door. She was outside at 7:24 in the aftermath of Hurricane Marta. The parking lot was a landscape of storm debris, broken branches, pooled water, leaves plastered to every horizontal surface. The air had the washed clarity of air that has been through something serious and come out on the other side, cold and clean, and carrying the smell of wet earth and ozone. The sky was moving fast, cloud fragments tearing across a brightening blue, the sun still low but present, throwing long gold light across the damaged landscape. Lauren stood on the sidewalk outside the ambulance bay and breathed it. Her phone, her real phone, the one she'd barely checked in 16 hours, had 11 messages. She didn't look at them yet. She stood in the cold morning air with her jacket open and her left arm visible, and she looked at Iron Harbor Medical Center behind her, at its windows and its nav beacons, and its structure still standing, and she thought about all the things a building holds without knowing it. The flip phone was still in her pocket. She took it out and looked at it. Then she put it on the edge of the ambulance bay rail and left it there for Sorrel, who would know to retrieve it. She was 2 minutes into the walk to her car when she heard footsteps behind her and turned. Mac. Out of the hospital, civilian jacket, his arm still in its brace. The head wound had been redressed. He looked like someone who had slept a total of 40 minutes and had made his peace with that. We're being transported to Harwick Regional this morning, he said. Once the roads are clear. Voss included. He stopped a few feet from her. He wanted to come say it himself. He's not cleared to walk yet. Tell him the chest tube comes out in a few days if the output stays clean, Lauren said. He needs to not climb any more stairs until that happens. I'll pass that along. A pause. He also wanted me to tell you, the preliminary hearing date is in 6 weeks. Your testimony is the primary thread. There will be others, but yours is what holds the middle of it together. She looked at the sky, at the tearing clouds. I'll be there, she said. There may be press, Max said. The Marin thing, a retired admiral in federal custody after a DOD inquiry, that's going to be visible. I know. Are you ready for that? She thought about 3 years of compression gloves, about inventory in a supply corridor, about the particular exhaustion of maintaining an absence where a person should be. I've been ready, she said. I just wasn't sure there was anything to be ready for. Mac nodded. He looked at her arm, the tattoo, the old scar along its edge that the tattoo incorporated and partially covered, the evidence of a life that had not been smooth or forgiving or easy to explain. For what it's worth, he said, from everyone on the team, what you did last night, not just the medical work, all of it, the roof, the statement, the way you held the floor together. He paused, and she could see him trying to find the right framing and landing on the honest one instead of the polished one. We didn't deserve you coming through for us the way you did, given everything. She looked at him. You were my team, she said. Once. That doesn't fully go away. He held her gaze. Echo, he said. And it wasn't a question, and it wasn't a summons. It was just the name. Said the way it was meant to be said, not as a call sign, but as a recognition. Get some rest, she told him. All of you. She turned and walked to her car. The federal inquiry moved faster than anyone had expected. This was the assessment of Adrian Sorrell, who called Lauren 3 days after the storm to give her the first structured update, and whose assessment was that the speed was a direct result of the quality and completeness of the evidentiary package. Pratt's filing, Lauren's recorded statement, the phone intercept from the second-floor corridor, and the operational data from the flight deviation that Voss's team had been assembling for 8 months. Douglas Marin was formally charged 14 days after the storm. The charges were multiple: obstruction of a federal military inquiry, falsification of official records, and unlawful influence of a personnel action, the last count specifically referencing the credential disruption that had been initiated against Lauren Hayes following her discharge from the 3rd Special Operations Group. The arraignment was covered by 2 national news outlets and 1 major investigative publication, which ran a piece under the headline, "Buried in Plain Sight: How a Decorated Military Medic Became a Hospital Floor Nurse While the Admiral Who Ended Her Career Sat on a Federal Oversight Committee." The piece was thorough and unsparing and got some of the procedural details wrong in ways that Sorrell said were inevitable when journalists reconstructed operational timelines under deadline, but the core of it was accurate. Lauren read it once. She did not save it. Gerald Fouche cooperated with the inquiry fully, which his attorney described as voluntary, and which everyone in the relevant process understood was voluntary in the specific way of someone who knew exactly how much trouble they were in and had decided that cooperation was both the right thing to do and the practical thing to do. His testimony corroborated the timeline of the credential disruption and identified 2 additional individuals in the DoD acquisition chain who had been aware of and facilitated the record falsification. He was charged with 1 count of accessory to personnel misconduct, and he pled guilty, and he received a sentence of community service and 2 years of federal oversight, which was either lenient or proportionate, depending on your precise calculation of what he'd known and when. And Lauren's own calculation landed somewhere she didn't fully articulate to anyone because it wasn't simple, and she wasn't going to pretend it was. Karen Whitmore resigned from Iron Harbor Medical Center 22 days after the storm, citing personal reasons in a letter that said very little and meant slightly more. The hospital board accepted the resignation and initiated an independent audit of administrative procedures. The audit took 3 months and produced a 40-page report that Dr. Harmon described, at the staff meeting where he presented it, as difficult reading and necessary. He was right about both. Look, the preliminary hearing was in the 3rd week of October in a federal building 2 hours north of Iron Harbor, in a room that was smaller than Lauren had expected and quieter. She sat at a table and answered questions for 4 hours, and she was precise, and she was complete, and she did not minimize, and she did not embellish. And when she was done, the review board chair, a woman in her 60s with the face of someone who had spent 40 years listening to institutional lies and had developed an exquisite sensitivity for the difference between them and the truth, looked at Lauren for a long moment before thanking her. Voss was there. His chest tube was out and he moved carefully, but he was there, in a suit that looked like it had been purchased for the occasion and didn't fit him quite right in the shoulders. And when Lauren came out of the hearing room, he was in the corridor and he stood up when he saw her. She held up a hand before he could speak. "I know," she said. He sat back down. She sat next to him. They sat there for a moment in the corridor outside the hearing room, just 2 people who had been through something and were on the other side of it, not yet sure what the other side looked like, but sure they were on it. "What do you do now?" he asked. "I go back to work," she said. He glanced at her. "I mean it," she said. "Harmon wants to talk. He's mentioned a trauma training program, something structured for nursing and emergency staff, combining standard clinical protocols with tactical care principles." She paused. "There's a gap in what most ER nurses are trained for: mass casualty events, penetrating trauma, rapid field-adapted decisions. I've been thinking about what that program would look like." "You've been building it in your head." "I've had a lot of quiet shifts." He almost laughed. "And the Navy offer?" Sorrell mentioned. "I know about the offer." She'd known for 2 weeks. A formal communication from the 3rd Special Operations Group passed through Duval, offering a reinstatement pathway contingent on the inquiry's outcome. "I'm not taking it." He was quiet. "It's not the right answer for me," she said. "I spent 3 years in that hospital. I know what the gaps are. I know which residents freeze and which ones don't, And I know the difference between a charge nurse who runs on protocol and one who reads the room, and I know where the supply closet is and which wing goes dark first on backup power. She looked at the ceiling. You can't build something useful if you keep leaving. Voss was quiet for a moment. Then, Iron Harbor is lucky. Iron Harbor is a mid-size regional medical center with a leaky generator and inadequate mass casualty protocols, Lauren said, which is exactly why I'm going back. He smiled. For the first time since she'd met him, through a trauma bay door, on a night when she hadn't been sure any of them were going to make it to morning, he smiled with his full face, unguarded, and it made him look younger and more ordinary and entirely human. I'm glad you were there, he said. I know, she said. You mentioned. The formal restoration of Lauren Hayes' military service record was completed 6 weeks after the hearing in a document that was not dramatic and was not ceremonial. It was a correction logged in a database, reflecting the accurate version of events that should have been logged 7 years earlier. No one called her to announce it. She received a letter, standard government formatting, informing her of the update and listing the corrected details. Rank, commendations, the actual outcome of the Carivo province extraction, which had been successful, which had always been successful, which had been recorded as a failure by people who needed a failure in that column and had found her name the most convenient one to put there. She read the letter at her kitchen table with a cup of coffee that had gone cold while she was in the shower. She read it twice. She put it down. She picked up the coffee anyway. There was no catharsis in the letter. She had expected this, had prepared herself for the specific disappointment of a document that couldn't carry the weight she'd spent years building around what it represented. A letter was a letter. A database correction was a database correction. The 3 years in the supply corridor were still the 3 years in the supply corridor, and the correction didn't retroactively change the shape of the mornings she'd driven to that hospital, telling herself this was what she was now, this was sufficient, this was what survival looked like. What changed was simpler and larger than a letter. What changed was that she knew, and the record knew, and the people who mattered knew, and the machine that had been built to make her small had been dismantled by the evidence of her own persistence. That was not a document, that was a fact. It would be a fact tomorrow, and in 10 years, and when she was too old to run a trauma floor, and no one was going to alter it again because there were too many people now who had been in the room. She finished the cold coffee. She went to work. The trauma training program launched in January. Harmon gave her a converted conference room on the second floor, the same floor where Marin had been found, which Lauren had mentioned to no one, and which she found in a way she didn't try to explain exactly appropriate. The room had whiteboards and a projection system in space for 12 participants, and the first cohort was a mix of second-year residents, senior nurses, and 2 paramedics from the Iron Harbor municipal system, who Harmon had invited because Lauren had suggested it, and he had agreed immediately. The curriculum was not simple. She'd spent 2 months building it, drawing on training materials from her operational years and from current emergency medicine literature, and from the very specific knowledge of what Iron Harbor's ER looked like under pressure, which corridors narrowed, which bays had bad sightlines, which situations the standard protocols handled well, and which ones left people standing still for 1 second too many, because no one had ever told them what to do when the expected framework didn't apply. Hale came to the first session. He hadn't been invited, specifically. The program was open to senior clinical staff, and he was senior clinical staff, and he showed up and sat in the third row and said nothing for the first 40 minutes except to answer direct questions, which Lauren asked him twice, deliberately, because his clinical experience was relevant and she was running a training program and not a reckoning. After the session, in the corridor, he said, "That was good." "It's a first session," she said. "There are gaps." "Every curriculum has gaps." He paused. "The section on decision velocity, the material on how long it takes a trained clinician to act when the situation doesn't match the protocol they rehearsed. Where did you source that?" "My own experience." He was quiet for a moment. "Will you consider adding a case study component? Real scenarios, anonymized. I have a case file going back 9 years. She looked at him. "Yes," she said. "Send me the files." He nodded and walked on. It was not a friendship. It might become something adjacent to one eventually, the kind of professional relationship that is built on mutual usefulness, and slowly, almost accidentally, accumulates warmth. Or it might remain exactly what it was: two people who had been on opposite sides of an error for 3 years and had found a functional way to be on the same side of the work. Either outcome was acceptable. She had stopped requiring more from people than they were capable of offering. What mattered was the room. The 12 people in it asking hard questions and taking notes, and staying after the session to argue about a scenario she'd presented where there was no clean answer. What mattered was Priya, who was in the front row and who had bought the textbook and who asked exactly the right questions because she had decided to stop letting the room tell her who got to learn. What mattered was Oda, who had found his footing and was now finding something beyond it. What mattered was Deb, who stopped Lauren in the supply corridor 2 weeks after the program launched. Genuinely in the supply corridor this time, both of them pulling materials, the ordinary business of the floor, and said, in the flat practical way that was simply Deb's way, "You know this changes what you are here." "I know," Lauren said. "You're not going to be able to be invisible anymore." "I know that too." Deb looked at her, at the bare arm, the tattoo, the person who had been in this building for 3 years carrying something that should have been visible from the beginning. "Good," Deb said. She took her supplies and went back to the floor. Oh, cheat. In February, Voss's team sent a package. It arrived at the hospital, addressed to Lauren Hayes, RN, and contained no note. Just a photograph, framed simply, taken the morning after the storm from the eastern side of the building. Iron Harbor Medical Center in the breaking dawn, storm debris in the parking lot, the sky behind it that ragged torn blue of aftermath. In the lower left corner of the image, barely visible, was a figure in scrubs standing at the ambulance bay entrance. Lauren. She recognized herself from the posture, from the bare arm. She put it on the wall of the training room, not above the whiteboard, not in any position of ceremony. On the side wall, where the participants could see it when they turned their heads, the kind of image that sits in peripheral vision and works on you slowly. Nobody asked about it directly for 3 weeks. Then a resident named Park, young, sharp, the kind of earnestly serious that sometimes grew into something excellent, said at the end of a session, "Who is that in the photo?" Lauren looked at it. "Someone who needed to figure out that hiding was more expensive than being seen," she said. Park considered this. "Did they figure it out?" "Working on it," Lauren said. She meant it. That was the thing about it. She genuinely meant it, because the figuring out wasn't done. It was not the kind of thing that finished. The record was corrected, and Marin was charged, and the program was running, and the floor knew her name, and all of it was real, and none of it was the end of the process of becoming a person who did not flinch from their own history. That process was daily, ordinary, uncinematic in most of its moments. It looked like running a training session, like checking a chart, like walking into a supply corridor and not needing it to be a punishment, like standing at a nursing station with your left arm uncovered and your name on the board and your record meaning something and doing the next necessary thing. The morning after a storm is not the hard part. The hard part is every ordinary morning after that, when there is no emergency to give you permission to be exactly what you are. Lauren Hayes had spent 3 years waiting for permission. She was done waiting. In March, when the second cohort of the training program began, she stood in front of 16 people. Residents, nurses, paramedics, a physician assistant from the urgent care across town who'd heard about the program and asked to observe. And she looked at the room, and the room looked at her, and she began. "The most dangerous moment in an emergency," she said, "is not when everything is going wrong. It's the 2 seconds before you decide to act. When you know what needs to happen and you're waiting for someone else to say, 'It's okay.'" She paused. "We're going to spend the next 12 weeks making sure that 2 seconds gets shorter." She picked up the marker. She wrote her name on the board, first and last, the way you do when you're the one running the room. Lauren Hayes. Underneath it, without deliberation, she wrote 2 letters. EC, not the full call sign, not a performance, just the reminder. For herself, for the room, for anyone who needed it. That a name can be taken from you and it still belongs to you. That the people who tried to erase you are not the authors of who you are. That survival is not a quiet thing, and hiding was never the same as being safe, And the moment you stop making yourself small to accommodate someone else's comfort is the moment the room actually changes. The 16 people in front of her were watching and waiting and ready to learn. She put the cap back on the marker. She began.